Today we're holding our Health+Culture conference in Dorchester, and we're really looking forward to hearing all the different voices in the room talking about how health and culture can work together to ensure that creative health is thriving in Dorset.
I believe that being creative is a fundamental part of being human.
We want people in Dorset and the surrounding areas to have very healthy and happy lives, and creativity is part of leading a happy and healthy life.
I think today is a little bit about joining up some of the conversations so that everyone can pull together a little bit.
I spend a lot of my time in my office working on a computer, so actually I've had a really enjoyable day, and it's been a real joy to come and meet people and talk to them and see them face to face.
I found some of the language difficult. Some of it is quite high-end strategic level, but I came for that as well. I'm really interested. I'll have to follow up on some of it, and other bits were just immediately really inspiring.
So having the opportunity to meet more people and to hear what they're up to and listen to the kind of projects they're running. And I think events like this give us a chance to bring as many people as possible together to try and tackle that in ways that mean something locally to the individuals that live in our communities.
Great day and lovely speakers, and it's really nice to get the mix of what can, on the face of it, seem to be two different worlds. They've definitely come together.
Whether it's a spreadsheet, whether it's case studies, you hear stories from people, there is obvious benefits from all the arts, cultures on people's mental well-being, which obviously then goes on to their physical well-being. What would be brilliant is if government centrally funded these things and put more value on it.
What has come out today is people wanting to connect with each other and wanting to build those networks so that creative health can move forward in a sustainable way. And I think part of that comes with a little bit of trust between organisations to work together, and also to work with a strategic organisation like ourselves so that we as a collective can bid for larger pots of money to therefore have longer projects that are therefore sustaining and thinking about when that money runs out, how they sustain after the funding has been spent.
Arts and culture need to understand education a bit more, and education needs to understand the health service a bit more, and the health service needs to understand the arts. We all need to learn because we've all got things that learning will be useful to all of us in different ways.
The energy in the rooms, even though there's been some quite complex discussions taking place, has been wonderful, and it's been a really fantastic opportunity to bring a very diverse and very knowledgeable group of people together to really think about how we make a step change and think of a path forward for creative health in Dorset and beyond.